Dr. Lacey Palmer, Dr. Mama Bear, coming to you live from Central Florida on the topic of ear aches, ear drops, and something else with an E, which I forgot. And excellent effort. Excellent effort. There we go. 3 E's: eardrops, ear aches, easy drops, and excellent effort. Excellent effort. Lots of ear cases lately. As a holistic practitioner, doctor of chiropractic, quantum nutrition testing practitioner, a lot of ear complaints, a lot of congestion, coughs, runny noses, sneezing, that kind of thing. So when those kind of symptoms occur, we look for what is the cause? What is the imbalance in the body? What is the toxicity in the body that is turning on the symptom? And so there are people that will react to storm changes. Low pressure systems, high pressure systems can actually build up pressure in the head, leading to ear pain, ear aches. Could feel, if one side is having trouble handling the pressure, could feel like a spinny type of sensation or a dizzy type of sensation. There are crystals that can form in the semicircular canals inside the ear that also can cause a dizziness type of feeling. Buildup of earwax on the eardrum can cause problems. Little kids have tiny, tiny, tiny ear canals. And so that's why it is recommended not to use Q-tips inside the canal, because you push earwax towards that eardrum, and that can lead to ear pain, ear infection, dizziness, can even turn on a fever. Sometimes ear-related stuff comes from the teeth. So someone may have a cracked tooth. I was talking to a patient, they had a crack in their tooth, and she said, well, it only hurts me sometimes. Well, if you're feeling pain, there's a cause to the pain, and it could be an infection in the tooth. And the infection in the tooth can refer to the ear. Problems with the jaw can refer to the ear. The sternocleidoid mastoid. So when you turn your head, this muscle here is the muscle that turns your head and bends your neck. So this muscle here, sterno, attaching to the sternum, cleido, attaching to the clavicle, mastoid attaching to the bump behind your earlobe, the mastoid. When this muscle gets trigger points in them, which is spasms in the muscle, that muscle can refer pain into the ear and make it feel full, have nothing to do with the ear itself, but can have something to do with the muscle. So you can actually bend your ear to the side of the muscle that you want to handle and put pressure on that muscle. You should not feel a pulse. If you feel a pulse, that could be your carotid, so don't push on that. So the muscle here, you can put pressure on the belly of the muscle and kind of roll your fingers together like this, and just put pressure there at the insertion. So down here, and then also up here, the origin of the insertion, and see if you put pressure on that muscle, do you feel anything referring to the ear? And the other side, so you laterally flex or bend your neck to the side, find that muscle. Some of you guys are doing it with me now. Bend, and you can put pressure on that muscle. And if it's tight, which a lot of people have tight necks, you can feel referral into your ear. You can actually feel your ear clear. And so if that muscle is very, very tight, it can cause ear pain. So many people are doing this all the time, right? I saw a kid at the airport the other day. His neck was so far bent like this, he could have just laid in his own lap. And so if you're going to be on your phone, you want it up. So you're looking up. You don't want to be down. The further your head bends down, the more strain on your neck. And so I'm starting to see younger and younger people losing the cervical curve, losing the curve in their neck. Now, who cares? Like, what would happen if you lose the curve in your neck? Well, what happens is you have the vertebrae. So this represents a vertebrae or a bone in your neck, and this represents a bone. And if it becomes where the neck becomes very, very straight, we call that a military neck. It sounds like a straight neck would be good. It's actually not good, because the neck cannot absorb force like this. And so you have the bone in your neck, and you have the disc in between. And so what we'll see on an x-ray is that you lose disc space. What we'll see is the person will constantly have tightness. If you push this on your body right now, this is your trapezius muscle. If you push on here and it's really tight and sore, it could be because your neck is coming forward too much. Why is your neck coming forward? Because people are typing on their computer, they're bent looking at their phones, even driving. I see a lot of people driving like this on the road. You want to put your head back on that headrest, not laying back like you're, laying back at the beach, but your head is against the headrest. One, that helps protect your neck in a car accident, because if your head's already back, it can't fling backward as much. And two, it can help reinstate the curve. The other thing that you can do is you can get devices like this, which just happens to be on this desk. You get a device like this where you lay on your back and you put your head through this cradle. Feels great. Really good for people who are on computers all day, right? Or seated a lot. You could do this. The low-tech version of that would be to take a towel. So you can take like a washcloth or a hand towel and fold it. It should be about a circle size, about this big in diameter. And you can put it behind your neck and lay on a flat surface and have your head go backwards. Now, depending on how straight your neck is, you might just start with laying on this for a minute and then increase to 5 minutes, and that will help reintroduce the curve in your neck. Now, one of my very first patients, I was in chiropractic school, I was teaching, she was a professional football player, she was on my team, and her neck was really straight, and she had headaches, and she had neck tension. And I remember at one point she could like barely turn her neck like turned this much. And so I told her, I said, okay, do the towel exercise, what I just described to you. Roll up a towel about this wide. You could put rubber bands on it, but not really necessary. Put the towel on the floor, lay on your back with the towel on your neck, and let your head fall over the towel. So you're laying down, but only do it for 1 minute. And I go, please, please, please do not do this longer than 1 minute. You're going to think it's like too easy. And I know you want to do more, but just do 1 minute. And she says, okay, Lisa, I got you. No problem. And the next day I see her, she can't move her head. And I said, hey, what'd you do? I go, let me guess, you fell asleep at the towel. She goes, how did you know? I go, well, you did 1 minute. You thought it was too easy. So then you stayed there longer and then you fell asleep. She's like, that's exactly what happened. And so it's kind of like going to the gym. You haven't been there in a while and you overdo it in your workout. You get really, really sore. This is a workout in a way, a very easy workout, which you get to lay down. So 1 minute with this, and then maybe the next week you can add 2 minutes, and maybe the next week you could add 3 minutes, and so on. Of course, if I'm not your doctor of chiropractic, I don't know your specific neck situation. So you would want to come see us at Palmer Natural Health so we can evaluate what the heck is going on with your neck. Now, most people, they think about their neck and they may pay attention to it if it's stiff. They may pay attention to it if it's not turning so well, but most people kind of ignore their neck. And they really don't care about their neck until they can't move it. Or what we also sometimes see is sometimes people will get numbness into their hands. The nerves in your hand that control your hand and control your arm and control your shoulder actually come from your neck. There's a series of nerves called the brachial plexus, and that brachial plexus controls your arm and shoulder movement. Now, sometimes we have patients come in and they feel numbness here in the 6 shooter, right? That corresponds to the C6 nerve in your neck. The middle finger corresponds to the C7 nerve in your neck. And the pinky finger and the ring finger correspond to the C8 nerve in the neck. So you have 7 cervical vertebrae, and the nerves underneath that is the number of the nerve, and they have different functions. And so if I have a patient that has numbness here, it could be from the lower neck. Why could it be from the lower neck? Well, maybe they fell asleep on the arm of the couch and jammed up their neck. And how we would handle that is we would do a chiropractic exam and then locate which vertebrae are out of alignment and do a chiropractic specific adjustment to put that back in alignment. And we've done that where numbness goes away. Maybe the person has temporal mandibular jaw. They have problems with their jaw. And we can actually do adjustments, chiropractic adjustments on the jaw. I had a patient who she was having TMJ problems that always caused her pain. And she went to her dentist, and the dentist wanted to shave down her teeth. And I was like, whoa. I go, that's like, I don't know, having a door that's not hung properly and trying to like sand the door, but really like the structure of the house is off, right? So you want to fix the structure of the house. And so I actually had to handle her spine and rebalance her feet. And when she thought it was the craziest thing, when I rebalanced her feet, her jaw pain went away. She thought it was crazy. She's like, there's no way this is going to work. I'm like, look, if I'm wrong, you can go get your teeth shaved down which will be a problem for you for forever. Or we can fix the foundation, we can fix the structure of your house, and then it'll alleviate your jaw issues. And that's what we did, and her jaw pain went away. So different reasons why people have earaches. There could be a bacterial issue. There could be a fungal issue. There could be a parasitic issue. There could be a compaction issue where there's too much wax in the ear. And so devices like this, which is super interesting, this is off of Amazon. It's called B-Bird. B-Bird. I am not an affiliate with them. But what's really interesting is that you can get attachments, stuff like this, where you can actually look in your own ear and look to see what's going on wax wise. And then maybe you need to go to an EENT and get your ears flushed, right? And so there's different attachments. I'm looking for the attachments. They seem to be missing. Oh, here we go. So attachments like, so here's the device. You can get an attachment like this and actually turn this sucker on. So you'll see that it'll light up. So it lights up. On the end is a camera, and put that in the ear canal. Now you don't want to get into the eardrum. You don't want to rupture the eardrum. So you want to be very, very careful doing stuff like this and be aware of what you're doing, right? And then that syncs to your phone. So there's an app on your phone that it syncs to, and you can actually see. So it's called B-Bird. You guys can't see that very good. And it will connect to this device. So it's connecting to this device. I'm trying to find the device. Come on. So let's connect to the device, and we'll see if we can get this to behave itself. Oh, there it is. So connecting to the device. And then when I connect to the device, it's trying to connect now. When I connect to the device, this will show me on my screen what the inside of the ear looks like, right? So I am not an ENT. I'm not an orthopharyngeologist, right? But you can take a look and see what's going on in there. Does it look like a lot of earwax? Does it look red? Does it look irritated? And if it is, then what could be done about it, right? What could be done about it is that you can go see an ENT, right? You can figure out the cause. And so the cause could be that you need your ears flushed. The cause could be that you're having eustachian tube backup. The cause could be, sorry, I'm trying to connect, guys. The cause could be that you are eating too much dairy and causing too much congestion in the body. All right, I'm going to try one more time to get this to connect so I can show you guys. Okay, good. So this is what it looks like. It's connected to my phone. I hit go. And then this is the camera function, right? So I can show you. If I send this if I put this at you guys can see my camera there. Here's my computer screen, right? Here's my daughter's stuffed animal. Okay, so I could show you the inside of my ear. I don't know if I want to show you, but here's the inside of my ear, right? So earwax and all. It's not the sexiest thing to show you guys on here, but you can take a look at the eardrum. How cool is that, right? So for $50, you could take a look really quick and see what the heck's going on. Again, not to diagnose. So I'm going to turn this off. Not to diagnose or treat your own ear, because that would be a medical doctor, but to just grab some data on what could be the cause. Is there some earwax in there where you need to do some earwax dissolving? Is there something that's irritating the ear? Did something get into the ear? So really, really cool stuff. So again, it's B-Bird. It's on Amazon. I'm not an affiliate. Maybe it will be soon. So this is what it looks like. $50. Take a look at the ear. So Leah started having problems with her ear. Took a look at her ear with this little cute device, because my otoscope, I actually have an otoscope. Embarrassing to tell you guys, I lost the charger for it. And so I have a physician grade otoscope. So scope is to look, oto means ear, and I can't find it. So for $50, because that thing was like $500, this thing for $50, I can look at her ear, and she does have some buildup of wax. And so I have to figure out if I'm going to irrigate her ear as her mom, or if we're going to go to an ENT, an ear, nose, and throat medical doctor, and have that earwax removed, because when it gets compacted, it can cause pain. When it gets compacted, it can cause dizziness. So some of you guys are even hearing loss, right? So I was kind of joking with her. Now I feel kind of like a jerk, because the other day I was asking her to do something and I'm like, can you hear me? Are you like listening? And she's like, what? And I thought she was just being a kid and not wanting to do the dishes or take the trash out or whatever. But after seeing her ear, I'm like, there's a lot of earwax in there. And so some people produce a lot of earwax. I am an earwax producer. I started to have issues after I played women's professional football, and I think it was from wearing the helmet and pulling the helmet up off my ears. Really irritated my ears. At that time, also, I used to like to drive with the windows open and the wind hitting my ears. At one point, my body made a lot of earwax. My ear got compacted, and it made me dizzy. It made it hard to hear. It made me just really not feel good. I went to an urgent care, and they had this irrigation system that had irrigation and suction, and I knew there was a lot in there when the tech was like, oh my gosh, So usually if you're in the medical field, if you see something crazy, you kind of keep in your, like we call it, like keeping in your doctor frame of mind, right? So if somebody has something really gross on their body, I'm like, oh my gosh, that's disgusting. I don't say that as a doctor. I just take a look at it and I say, oh, wow, it looks like that hurts, or that looks irritated. I don't want to offend the person or upset the person. Well, this tech that was cleaning out my ear was like, oh my gosh, it looks like a squirrel. And I was like, what? And he's like, oh, nothing. Because there was a lot of stuff that came out. So that can cause ear aches. Robin's saying, I have weird ear things happening. So a lot of people are feeling pressure. Are there natural ways to get rid of earwax? So with quantum nutrition testing, which is what we do at my office at Palmer Natural Health, is we're looking for the causes of imbalances, right? So we're looking to see, is there possibly some kind of irritation in the ear canal? Is the person living in mold? Because mold can cause congestion in the lymphatic system. And when I had one of my ear episodes, I was living in a house where it was built in the 50s and it had the original roof. And we found in rainy season that the master bedroom had a leak. It was actually raining in our master bedroom. I called my insurance company. They're like, yeah, we don't cover that because we can't find damage on the outside of your roof. And I'm like, but I have rain, and the rain's coming from the outside into the inside. They're like, well, maybe it's a pipe. I'm like, I don't have pipes in my ceiling. What are you talking about? And anyways, we decided to have the roof replaced. We paid for it, out of pocket. And when the roofers worked on it, they were shocked. The roof was the original roof of the house. And they said, like, instead of 2x4s, they use 3x4s or 4x6s. They use weird wood measurements that they don't use anymore. That they've had weird cuts of wood back then. And then the construction guys were saying, the roofers were saying, it looked like someone shot cannonballs in the roof. There were huge holes, and they didn't know how we didn't have even more leaks, right? And so exposure to mold can cause problems with ears. Like I was talking about earlier, jaw problems can cause problems with ears. Certain foods can cause more earwax production. So maybe someone reacts to dairy. That can cause more inflammation in the body. And so figuring out what the cause is and handling the cause. And if you do think it's an ear infection, if you do think it's an impacted ear, seeing an ENT who is a specialist in ears, nose, and throat to see what they can do to handle that. If you're looking at more natural means, you can look at certain drops. So sometimes we use stuff like this, where if we locate what could be the imbalance, there's drops like this could be put on your finger, placed behind the ear. There's people that really love to use garlic oil, because garlic is a natural antibiotic, meaning against bacteria, antifungal against fungus, antiparasitic, and that ear oil could be placed behind the ear on the mastoid bone. I have sensitive ears. I don't like extra stuff in my ears, but you could put the drops in the ear. There are different ways of softening wax. So some people will use hydrogen peroxide. Some people will use different physician formulas that drops could be put in there, and then the ear can be irrigated. When my ears were super, super bad, I went to a medical doctor in Atlanta, and they told me to get a capsule of stool softener and to put a drop of the stool softener in my ear. And I'm like, are you crazy? Like, I'm not doing that. And then my ear was hurting me so much, I actually did that, and this big chunk of wax came out. And so the stool softener, of course, softens. It was a drop in the ear. I thought it was the grossest idea until it did work and soften the wax, and then the wax was able to come out. So most people, you take a shower, you wash your hair, water gets in your ear, the body handles the wax, pushes it out, no big deal. And other people could be the development of the ear canal, or they have smaller ear canals, or they have problems with their jaw, or problems with their neck, or inflammation in the body, and then they need a little extra ear help. So there are drops that could be used. This is a homeopathic. It's called throat spray tone. It helps to break up inflammation. So if the inflammation is coming from the throat, you could spray some of that in there. There's a homeopathics to break up congestion. You could spray the throat, right, and rub that on the throat. You could put that behind the ear to help the lymphatic system drain. Other drops could be put behind the ear as well, could be placed on the sinuses to help with any kind of inflammation. So we would look to see, is there a reason for the imbalance? Michelle says, that's cool. Robin says, I had the weirdest thing happen this week. I had water in my ear, but it wasn't in the pool and had showered the day before. I had to use hydrogen peroxide. Yeah, so water in the ear could be congestion in the ear canal. It could be an inner ear irritation. And so the hydrogen peroxide can dry that up. So yeah, so pretty cool device. And so if someone is having issues with their sinuses, if someone's having issues with their ears, if someone is getting a lot of sinus pressure, if they have a sore throat, if they have a cough, if they have swollen tonsils, if they have swollen adenoids, the tonsils and the adenoids are immune system tissue. And so if that tissue is swelling, they could have a sore throat, they could snore, they could have difficulty breathing. Now, if it's a medical emergency, obviously go call 911, go to the hospital. If it's life and death, go to the hospital, right? But if the lymphatic tissue, if that immune tissue is swollen, it's fighting off something. Chronic mold in a house can cause the lymph nodes to increase in size, can cause the adenoids to increase in size, the tonsils to increase in size. So that tissue is fighting off something that is in the environment. Exposure to chemicals can increase the size of lymph nodes. And so what we look for is, we're not treating the condition, but we're looking for the imbalance. We're looking for potential causes. We're like little health detectives, and we're looking for what can be done about it. You could take a washcloth like this. You could boil some water, or turn the tap on warm, put the water on the washcloth, wrap that in another towel, right? And then place that over the ear, obviously not boiling hot, but place that on the ear, and the heat can help. Ice can help as well. And so there are things that can be done with ears. There are things that can be done with sinuses. We don't want to suppress the symptoms. We want to find the cause. I'm Dr. Lisa Palmer, Dr. Mama Bear. If you need help with ears, sinuses, congestion, coughs, that kind of thing, and you're looking for natural solutions, direct message me, reach out to my office, Palmer Natural Health. Good night, everyone.